Thanks for the introduction. It's a pleasure to be here, and as Anthony said, I've done research on a lot of different topics: economics of abortion, gambling, Brexit. So I thought it was about time to tackle something that isn't controversial at all. Hence, it's been an interesting 12 months since I started sort of looking at the coronavirus data. Really, like lots of people, you go into lockdown and sort of not quite sure what you're going to do with your time, and then one thing leads to another, and before you know, you're invited to to give a talk at BIOS, which is which is great. So I'm going to, it's a ethical institute. I'm not going to say a lot about ethics, and Anthony, I think, was quite happy for me to talk more about the the data and the evidence, but obviously there's an ethical context. So we've got many greater ethicists than me here today. In fact, economists famously don't have any ethics at all. We have no morals, no ethics. But I will say one or two things and give my view. But I'm very interested to hearing what other people say as well. First starting point is definitions, and actually I'm not going to worry too much about definitions, because lockdowns can mean a huge variety of different things in different contexts. Generally, when governments or the press talk about it, they tend to be talking about national stay-at-home orders, usually which follow on business restrictions and travel limits, but that seems to be the sort of key where people start talking about lockdowns. There's a nice paper you may have seen by Edward Hadas where he describes it as severe ongoing government restrictions on normal activities. And I think that's quite not a bad definition. My preferred definition is something slightly different. I think it's this one. If the pubs are shut, then I think we're in some sort of lockdown. And I'm sure you know the famous Belloc quote that once you've lost your inns, drown your empty cells, because you will have lost the last of England. So this is the talisman for me. But as I said, I'm not going to worry too much about the definitions. We can talk about sort of heavy restrictions or a formal lockdown, and I will sometimes use them a bit interchangeably, and you may want to pick that up later on. So a sort of starting point about why might lockdowns be ethical or not. As Edward Hadas suggests, they involve really quite serious matters. So really unprecedented and quite draconian restrictions on human life, which may call into question whether we're maintaining respect for human dignity, or looked at another way, human rights. And these affect all sorts of things, from the basics of companionship and love, religious worship. Those of you who live in Scotland will know you've got another 6 weeks, I think, before you'll be able to attend mass or church. At the moment, if it's certainly, I think it's the same in Scotland, it's a criminal offence if you attend mass as a member of the public in Scotland. It certainly was in England during the November lockdown. There's issues about your right to education, to schools, to providing for your family. So government ministers can, at a stroke, decide overnight that your business will be shut down without any reference to Parliament. There's issues for all sorts of normal interactions that we see from day to day. So these are really serious things, and they're not in place just for a day or a few days in some sort of emergency. They're in place long term in many environments around the world. So these are serious, and it may be the question for many people is, well, they're just unethical flat out, they should never be applied. However, COVID-19 is very serious too. So in the UK, for example, depending on the measure you use, if you look at the ONS definition, there have been about 140,000 COVID-related deaths, so deaths where COVID is mentioned on the death certificate since the start of the pandemic. And for some people, it's sort of the other way around, if you like, that when you're talking about death and health, especially at that sort of number, it's almost unthinkable to question the issue of lockdowns. Of course, they're ethical because of the serious consequences for human life. So I'll say a little bit more about that in a second, but just sort of I wanted to summarize how lockdowns have been sold, or the assumptions that underpin them in the UK at least. And I think there's three things that are going on. There's more than this really, but The first is that we're told, and generally speaking, coming up to a lockdown, that in the absence of restrictions or typically a national lockdown, we're told cases are going to carry on rising. You've got a big surge in cases. This is the only way to get cases to come down. Otherwise, eventually, health services will be overwhelmed. Okay, fine. Second point, which of course has to matter, that may be true, but it's irrelevant if imposing the restrictions doesn't have a big effect on reducing cases or hospitalizations and deaths, and that's a second underpinning assumption. And then there's a sort of counterpart to that, that if you were to relax restrictions or relax them too soon, you'd have a big impact in the other direction. And I'm not going to say a huge amount about the sort of costs and benefits, but I wanted to say a little bit about that, just to sort of put that into context. Because if we move beyond the situation of, do we think that a lockdown might be ethical? Perhaps come back to that in the discussion at the end. Then we need to think about these issues here. And first question some people have is, can you ethically trade off deaths and the economy or other factors? And we're talking to top ethicists here. We can very quickly answer that question. Yes, of course we can, at least to some extent, and we do that all the time. In case anyone's in any doubt, obviously there's a difference between deliberate killing and the deliberate killing of an innocent person. We might think, well, that can never be justified. The end can never justify by the means. But a difference between that and a policy or something that happens that may result in somebody's life expectancy being lower, or may indeed result in some deaths. There's quite a difference there. But of course, many government policies involve some sort of trade-off between health, deaths, economic, other social costs. So, the government allows a factory to open which may pollute or send out some pollution. There may be some impact on the environment which affects, reduces life expectancy. They don't necessarily say it's an absolute no. They take into account what are the benefits, how serious are the consequences, how many deaths are at risk. And pretty much true for so many government policies. What speed limit do we have on the motorway? It may well be that the speed limit of 60 miles an hour would save some lives relative to 70. Doesn't necessarily mean we straight away go for that 60. We think about the costs and benefits involved, and there's lots of methods for evaluating those sorts of trade-offs, and lots to be said about, some people hate the idea of the quality adjusted life years, but there's revealed preferences. There's ways in which we value life to some extent, which you may be, more or less happy to go along with. I don't want to get involved too much into that debate beyond saying, well, yes, we can make some sort of trade-off. I do want to just give an idea about the sorts of numbers we might be talking about. I'm not going to go into a long detail about cost benefits. Funnily enough, there's not been a huge amount of proper cost benefit analysis about the impact of lockdowns. And one of the things we need to say straight away, it's very hard because you need to separate out the effect of a cost of a lockdown from the effect of a cost of the COVID pandemic anyway. So even if we didn't have a lockdown, having a pandemic with lots of people dying will impose costs on an economy and affect behaviour. However, this paper here by Professor Miles from Imperial in the National Institute was a sort of an early-ish stab at doing this, and it's quite helpful just to illustrate some of the orders of magnitude. So the standard NICE trade-off, they suggest that a treatment, if you're expected to increase life expectancy by a year, you shouldn't spend more than about £30,000. So they're sort of implicitly valuing that year of life expectancy of £30,000 based on lost earnings and so on. For some, that's quite controversial. So there's some people would say, well, maybe you should have 2 or 3 times that number. Back of the envelope calculation, which Miles do, say, well, how many average life years are lost from a COVID death? Well, given the age profile and the profile of other health conditions, they suggest we're looking at perhaps 5 to 10 years. So what does that mean? Well, if you're doing this cost benefit analysis, you might be looking at a low point, £150,000 for a life. at a high point, maybe, not far off £1 million. Okay. On the other side of it, Miles made a stab of looking at the economic cost of lockdown. So not, trying to separate out the impact of the pandemic itself, and looking at ranges of GDP, comparing to countries with and without lockdowns and so on. They had a very big range of estimates, from 200 billion to a figure much bigger than that. But on top of that, you need to factor in lockdowns don't have some sort of marginal effect, or indeed some sort of big independent effect. So that's a sort of second question. Even if you didn't, accept, well, lockdowns aren't the only way cases will come down, how effective are they at reducing infections, or more particularly deaths and hospitalizations? So again, we can look at the academic evidence, and there's a growing set of papers here, and we can sum it up fairly simply. It's mixed. There is no consensus in the academic evidence. There's the quite famous Flaxman paper in Nature, some of you may be aware of, which has a huge estimate of the number of lives averted by lockdown, somewhere in the region of 3 million. Actually, I think of all the papers that make a case for lockdowns, Flaxman is not a good example at all. You look at the methodology; it's not really an estimate of the impact of lockdowns. It's more a modelling exercise whereby the way they set up the model, the only way infections can change or deaths can change is by compulsory, mandatory changes. They don't allow for any possibility of voluntary change. So it's almost by definition they come out that this high estimate. So I don't think, actually, although it's cited a lot, it tells us much. But there are other papers which find that there are significant benefits from lockdowns and different types of restrictions. Benvedid's one the other way around, finds no significant effect at all. So they say we can't rule out small effects, but statistically there's we can't distinguish the effect from zero. And they have a nice difference in different sort of methodology, comparing restrictive to less restrictive interventions. There's quite a nice summary which has been published recently of the literature review of the economic evidence. It's still a working paper, but I think it's quite a decent coverage of lots of these papers, and there's quite a wide variety. Herbie is quite nice because it separates out, or tries to separate out, papers which look at the effect of lockdowns, of mandatory restrictions, and separate that from, as far as we can, from what would have happened anyway, from behavioural change. And they find actually the vast majority of the effect of the growth on pandemic of infections comes from voluntary behaviour change. In other words, people changing their behaviour. There's a very limited impact of mandated behaviour change. They estimate on average, you looked at the mean 9%, but actually looking across the studies, you use the median, it's as low as nothing. So you look at the range of studies, they conclude, yep, there may well be some small benefit from lockdowns and significant restrictions. We can't rule out that there's no benefit at all, but on balance there probably is some, but it's not very big. Okay, and for some this is almost, how can this be? It's so obvious. You have a lockdown, you have restrictions, you shut the pubs, people aren't interacting. It must be the case that has a big effect on reducing infections. I think when you think it through, there are lots of reasons why that might not be the case. I just want to illustrate this sort of general academic point just with a few empirical examples. We shouldn't really be sort of establishing a point by anecdote, but on the other hand, to illustrate from this general academic overview of evidence, I think is quite helpful. Here's just one example. So here we've got 5 really hard hit countries that had big outbreaks: UK, Spain, Czech Republic, Sweden. Everyone wants to talk about Sweden. I'm sure we'll come to that in the discussion. The USA, not totally picked at random, partly picked because they have such a range of interventions. So the UK, we've had these 12 months of rolling lockdowns and restrictions. Looking most recently, Spain had a very strict lockdown. More recently, they haven't had a winter lockdown. Lots of restrictions, lots of regional effects, but you may have seen the pictures of the pubs in Madrid being open even while they had a big surge. Czech Republic, a big strict lockdowns, and most recently pretty much going on since October. Sweden, as we know, and the US, huge variations. Here's the sort of the pattern of infections, making your eyes go gozzy since December. So looking at the winter wave, I really put it here just to say, actually, this backs up what what the academic evidence is saying. It's really hard to pick a pattern. You see almost all of these countries have had some big surge in cases, followed by a decrease. Whether they're in a lockdown, strict lockdown like Czech Republic or the UK, or not really in a lockdown like Sweden, it's a bit lumpy here because of the way they've reported the data. Actually, you go back to the original Swedish data, it's a little bit smoother. USA, similar, although massive variations in their states. Spain, a little bit later their surge because they had a big autumn surge, but the same pattern, going down, even though they haven't had a national lockdown. Czech Republic's an interesting one. Quite a lot of countries have had an increase in cases just in the last couple of weeks. Worldwide, cases have been going down. Possibly UK infections are just starting to turn a bit. We'll have to see. That may affect the lockdown plan, I would expect, but it's what we're seeing across Europe, the same in Sweden. Czech Republic actually in the end of January had a big increase. They sort of saw this increase in cases, and they tightened up their restrictions even more. They had quite a tight lockdown already. How much it's enforced is perhaps another matter. They've still seen infections carry on going up, possibly related to the new variant being more infectious, as is perhaps happening in Sweden. But it sort of illustrates the lesson. Lockdowns may have an effect, but they don't stop cases going up. They don't necessarily, they're not the only way cases may go down. If you look at the big picture, they don't seem to be the driving force. What about the November national lockdown in England is quite a good example, because you look at some of the case data, it seems, you can see this big sort of dip, increasing dip in the case data as the lockdown comes into play. And actually, it varies a little bit, partly because the regional data was so mixed. But there may well have been some impact of the November lockdown on cases. But what was the impact on deaths and hospitalizations? What we were really interested in, what it was really introduced for. And because of the English tier system, it's quite a nice example to look at, because what we saw in England before the November lockdown, we had a number of areas that were already under quite strict controls and restrictions. So we had most of the Midlands and the North, one or two exceptions, most of those areas were already effectively in tier 3 and had quite tight restrictions. Most of the South and the Southwest and East Anglia didn't. So what would that suggest? It would suggest if you have a lockdown, the impact on cases, you're ramping down interactions much more in one group of areas than the other. So it's a way you might get to some sort of causal effect. Do we see a bigger impact, even though cases might be lower in one sort of areas than the other? Is a change in cases or the trend more affected in some of those areas? So let's look at the impact on deaths. This is a national effect. And this is, the estimated lockdown effect using the CDC median effect. We can't be precise about this. Maybe we can go 1 or 2 days either side, and you can have all sorts of other complications. You can have various rounds of infections, which might suggest we'd only expect to see a lockdown effect much later. This is probably the sort of the earliest sort of time. What was going on? Well, we see again, deaths were going down, or at least deaths from infections were going down before the lockdown started. So it wasn't that deaths were going down before the lockdown started, but infections which ended up relating to deaths were going down. What happened after the lockdown? Not a huge amount. They carried on going down, perhaps a little bit steeper here, but they didn't carry on going down for very long. What happened over time? The infections seemed to go up again during the lockdown, while national lockdown is in place. Okay, maybe due to the new variant expanding in in the south, in London and so on. What happens when things were relaxed? For example, London, the pubs were allowed to open. I know there were still restrictions. In Nottingham, we haven't had a pub open since the end of October, but there we go. Was there much of an impact from relaxation? Nothing really obvious that you can see on the trends. What about the difference? So these are the areas where we shouldn't see so much of an effect. We might still see an effect. This is like Nottingham, the North, East Midlands, and so on. So here's the Northwest. We can see very clearly infections were going down. Was that due to the tiers and so on? Maybe that's another point, perhaps. But infections were going down. Lockdown started. Can we see much of an effect? Not really. Similarly, when lockdowns relaxed, again, not much of an effect, and a real variation across the regions. But when we compare this to the areas which should be more affected, again, it's just so hard to pick out anything. So here, for example, is, there's your that sort of orangey London effect. Nothing much going on there. There's the East, deaths were going up a little bit. Yeah, possibly the lockdown caused deaths to go down a bit there, not for very long, and then they started going up, maybe with a new variant. Is there much of an effect on trends when we relax the lockdown? No. People talk about the Southwest and Cornwall and so on, where the pubs are allowed to open. Actually, you look at the effect on hospitalizations much, much later than we'd expect from relaxing lockdown. Okay. I'm going to skip over the hospital admissions, but the same sort of effect. To summarize, it's really hard to see any impact at all of the November lockdown on deaths or hospitalizations. Maybe there was some, when you look at all the other factors going on, but it's not no clear, obvious effect. Another example, Florida in September, famously, their governor said, right, we are no longer locking down. They had a low level of cases in September, but they said bars are no longer shutting. Schools are staying open, even if cases go up. And you know what? Cases did go up by quite a lot. And there's a sort of Florida effect. Cases went up by a lot. They also went up in pretty much every other state in the US. This is the California, where they took the different approach, and most schools shut. Again, big regional differences, but widespread lockdowns or close to lockdowns. Okay, there's always differences when you compare countries and states, but California and Florida, there's lots of similarities as well. In fact, Florida has a much older age, much bigger older age population, so it might be more vulnerable. What happened to the pattern? I think the thing that strikes me is how similar it is. They both had a big increase, maybe some Christmas effects there, and then cases come down. Can you see, Florida took that decision. Is there really any evidence of an effect? No, it didn't stop cases going up, but it didn't stop them coming down either. So we can summarize, data suggests that there's not a big effect. We can't say there's no effect. There may well be some marginal effect, but the data and the academic evidence suggests. Things may be different. So, New Zealand and Australia very famously had a very early lockdown before the virus was widespread, but also very strict border controls. Okay, I think there's good evidence of what New Zealand and Australia have, at least for the time being, kept the virus under control. Actually, even then, Chile is an interesting counterexample of another country with a very early lockdown, very strict rules, supposedly border controls. I'm not sure how effective they were, which may be the difference, but it's not clear. And of course, what will happen with New Zealand and Australia in the long run is another debate. So it doesn't mean that no lockdowns are ever effective. We can say the same, I haven't gone into it, but many individual restrictions. We could talk about schools, the evidence there, very mixed evidence. Curfews, the very odd substantial meal rules we had in the UK. Much of that evidence is weak to non-existent. Why is that the case? Why are lockdowns not very effective? Well, some of the reasons we've talked about already, but we can think about voluntary behaviour change, may be important. I talked about how my mum changes behaviour. And a relevant point on that is that voluntary behaviour changes affects the most risky situations. So my mum is vulnerable, and I see how her behaviour changes. There are other people I know who I won't mention names to get into trouble, but I know people who are students who have had COVID, and all their friends have had COVID, and they react in a very different way. So they don't change their behaviour as much. And you can think sort of stereotypically, you're going to the pub, you live with your elderly granny who's very vulnerable, infections are going up, you decide I'm not going to go to the pub because I'm worried I'm going to infect my granny and kill her. Okay. Where on the other hand, you're a group of students, you live together, you maybe all had the virus anyway, you think, well, it's, we're not so much at risk, you still go to the pub. What happens? So voluntary behaviour change cuts out the most risky behaviour, Of course, there's still some risk from even those people going to the pub and maybe still transmitting, but it's less risky. What happens when you have the lockdown? The pub shuts to everybody. So you had already cut out the more risky behaviour. You now cut out the less risky behaviour. So we wouldn't expect such a big effect. We might expect some effect. However, restrictions also cause unintended behavioural effects. I don't mean to pick on Nottingham, but this was we were always in the news back in the autumn with our huge spike in cases. And this, when we had the 10 p.m. curfew back in September, these were the pictures that were flashed around of Nottingham. You had a 10 p.m. curfew to stop people drinking late into the night, stop them getting drunk. Oh, this is going to help keep infections down. What happens? Everyone piles out of the restaurants and the pubs at the same time. You have the same in London. They crowd onto the tubes. Perfect environment for spreading infections. And there's all sorts of unintended consequences you can have. You shut the pubs. What do young people do? Okay, you shut them for a week or two. Yeah, we'll go along with it. We'll stay in. You shut them for 6-7 months. Are young people going to stop meeting up? Well, I think we know the answer to that. Where are they going to meet? They're going to tend to meet in homes, have gatherings, maybe without the COVID restrictions that a pub or a restaurant might have. Some of these behavioural changes may actually make things worse, and there's all sorts of things you can think might happen. There's other reasons why lockdowns may not be so effective. Actually, we know a big proportion of the deaths come from outbreaks in care homes and hospitals. Okay, there may be some impact from community transmission there, but it's going to be more related to infection control in those environments. And then we've got the sort of other drivers of effects. So, when we look at the data, it's not that encouraging. When we looked at, the sort of Imperial modelling, hundreds of thousands of deaths being averted, the evidence simply is not there for that sort of order of magnitude of deaths or lives saved. We can't rule out that lockdowns and restrictions may save some. They may have no effect at all, but we can't rule out there's some impact. But we're certainly nowhere near that sort of level of magnitude. Is there a case for an ethical lockdown? I have mixed feelings on this. I put this here just to sort of, spark discussion. I think we do accept that governments can intervene sometimes in quite draconian ways, in wartime, in very serious emergencies. And I've got these sort of 5 criteria where you might think of it that you've got a really significant crisis going on. There's nothing else you can do. If it was a case that you genuinely thought voluntary measures weren't going to help, you are pretty sure that the restrictions were going to be effective. Not only that, you were also sure they were going to be effective, but the benefits outweighed the costs. But I think also crucially, the restrictions are short-term and strictly time limited. I think there's a difference doing, not allowing people into churches for a week or 3 weeks to flatten the curve, or not allowing people to leave their homes. There's a difference between that and doing that for months on end. Okay, I would suggest that actually none of these conditions have been met since the coronavirus has started. Okay, not a single one of those 5 conditions. And as a result, the use of rolling lockdowns and restrictions, I don't think they're appropriate, nor are they effective as a strategy for public health crisis. You look at the UK, a classic example. We are ranked at the moment as being in the strictest lockdown in the developed world. And you look back across our rolling restrictions, it's hard to find other countries which have been stricter in terms of lockdowns and restrictions. Did that rolling pattern, did it stop us reaching peaks, terrible peaks of deaths and hospitalizations? No, it didn't. Now you can argue, well, we might have been much worse. It's hard to see actually that when you look across the world, that realistically would have been much worse. Okay, and I think actually sometimes we need to take a step back. So as I said, I talked to my mum a lot. The other day, she, we've been in lockdown. She said, well, one of her friends, she hasn't seen her friends for a long time, for a couple of months. She occasionally goes out for a walk with some of them, but they used to meet up for a coffee. This isn't my mum, by the way. And she said, well, one of my friends went past, I hadn't seen her for a month, and she waved at the window. I said, oh, come and have a talk. And I said, would you like a coffee? So I thought, oh, yes, please. I gave her a coffee. She stood at the doorstep. And I said, Mum, why didn't you invite her in? And she said, oh, well, that would have been against the rules. Now, of course, actually, what my mum did was against the rules. To stand there, for her friend to stand there in the doorstep and to have a cup of coffee in lockdown was not just against the rules, it was a criminal offence. Okay. And if we take a step back and think, inviting somebody into your own home for a cup of coffee or standing on the doorstep having a cup of coffee is a criminal offence in this country. Not only that, it doesn't matter that my mum and this other lady had been pretty much isolating, there were no risk to each other. They'd both been vaccinated several weeks before, which would have lowered the risk again. People may have had coronavirus themselves and be immune. It was a criminal offence, and not a criminal offence just for a week or two, but for months on end. And in some parts of the country, it's not far off a year where that sort of normal activity has been a crime. Okay. Now, when you think of it like that, and that's just one example, you think of young people, you think of religious communities, all sorts of areas. Not only is it inappropriate, I would suggest that the long-term criminalisation of ordinary human behaviour in ways that fundamentally affect family life, faiths, livelihoods, I think it's unethical in and of itself. I think it's immoral, and I'm not a lawyer, but I think arguably in international law it's criminal. So as I said, I don't like to be controversial in any of the topics I do, but I thought that might be a good point at which for me to shut up and hand over back to Anthony to see, hope I haven't gone too far over time, Anthony, to see you know, what comments and questions and views people have.